Citizens and residents of St. Kitts and Nevis, I bring you greetings on the observance of Caribbean Wellness Day, September 11th, 2010. This special commemoration was endorsed by heads of government during their historic summit on chronic diseases held in Port of Spain, Trinidad in 2007. The Ministries of Health, through their health promotion units, continue to carry out the mandate of the Port of Spain Declaration. I wish at this point to commend the local organizing committees for their work in coordinating these annual observances. I, however, urge the general public to continue wellness activities all year round. The Caribbean is the only region of the world where heads of government have met and decided a framework of action to prevent and control chronic diseases. The reason is clear and compelling. We have epidemic levels of obesity, diabetes, heart disease, cancer, strokes, and high blood pressure. Too many of our people have either been disabled or have succumbed to these chronic diseases. This loss of good and productive people from the workforce is a real threat to our economic growth and development and must seriously be addressed. The observance of Caribbean Wellness Day is therefore necessary to continue raising awareness about the need for each of us, together with our extended families, community groups, and government, to work collaboratively to improve our personal health and, by extension, the health of the nation. According to our research, St. Kitts and Nevis has world-leading rates of obesity, diabetic amputations, and new cases of cancer. The reasons are well known. As a people, we eat too much unhealthy food, drink too many sugary beverages, and consume far too much alcohol. Our consumption lifestyle is mainly responsible for the cancers, heart attacks, diabetes, and strokes with which we are diagnosed. And the costs are phenomenal, whether in personal medical bills or in government expenditure to keep health facilities available, accessible, free, and stocked with medicines and testing equipment. In the year 2009 alone, government spent $700,000 East Caribbean dollars in the treatment of cancers, heart attacks, diabetes, and strokes. Of particular concern is the fact that an increasing number of small children and teenagers are being diagnosed with diabetes because of the regular intake of unhealthy food and sugary beverages, excess weight, and lack of physical activity. In St. Kitts and Nevis, there is morbid obesity in children, which can only lead to escalated numbers of children with diabetes in the not-too-distant future. For its part, my government will continue to invest tax dollars to keep health facilities and services affordable, available, and accessible to all. However, in the final analysis, each person, each family has to do what is right, what is responsible to lead healthy, productive, and happy lives. As Minister with responsibility for health, I must tell you that throwing more and more taxpayer dollars at sickness is unsustainable. Prevention is still always better than cure. To that end, My ministry is focused on a primary healthcare strategy that ensures that much-needed health services are available close to where people live and work. In addition, we will continue to advocate for public policy such as VAT exemptions and zero rating for vital and essential goods and services in the interest of our health, making them easier to access by all. The Health Promotion Unit will continue to promote wellness messages and campaigns throughout the year. For wellness is not just about Caribbean Wellness Day, but a habit that allows us to take control of our health and live with dignity beyond 80 years and 10. The book of 3 John and verse 2 says, Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. Like the Apostle John, I wish for all of us to prosper and be healthy in every regard. My sincere commendations to all those who exercise regularly and who make every effort to eat healthily on a daily basis. It takes much discipline to develop that habit. I know that you need every encouragement to keep the faith. To those who are yet to develop the healthy eating, regular exercise habit, I encourage you to mark today, Caribbean Wellness Day 2010, on your calendar as the day when you begin to make that change. I appeal to every one of us to make a conscious decision to take full control of our health. After all, our health is still our wealth. Have a great Caribbean Wellness Day 2010.